Healthcare is not confined by borders. The money spent on medical treatments in one country can impact the health of people in another. This connection is most evident in the flow of profits from the U.S. healthcare system to investors around the world. The U.S. spends more on healthcare than any other nation, leading to significant profits for healthcare companies. These profits don't just stay in America, they become part of a global financial system, influencing healthcare access and affordability in countries like New Zealand. The U.S. healthcare system is unique. It's largely private, with insurance companies and pharmaceutical giants playing a major role. This structure leads to high profit margins for healthcare firms. Studies show that U.S. healthcare companies often have higher profit margins than their counterparts in other developed countries. This difference in profitability attracts global investors seeking returns on their investments. When U.S. healthcare companies generate profits, they often distribute a portion of these earnings to shareholders as dividends. Many of these shareholders are international investors, including pension funds and investment firms. These dividends flow overseas, becoming part of the financial resources of other countries. This means that, in a way, profits from American healthcare are helping to fund economies and social services in other parts of the world. New Zealand, a small island nation, boasts a universal healthcare system. The government funds and provides healthcare to all citizens. This system prioritizes access and affordability over profit. As a result, New Zealand's healthcare providers operate with much lower profit margins compared to their U.S. counterparts. They focus on delivering essential healthcare services rather than generating substantial financial returns. The contrast between the U.S. and New Zealand healthcare systems reveals a fundamental difference in priorities. The U.S. system, driven by private companies, prioritizes profit. New Zealand's system, funded by the government, prioritizes access and affordability. This difference in priorities leads to a disparity in profit margins. U.S. healthcare firms generate substantial profits, attracting global investors. New Zealand's providers operate with minimal profits, focusing on serving their citizens' healthcare needs. Dividends from U.S. healthcare companies flowing into New Zealand's economy have a ripple effect. These funds contribute to the country's overall financial resources, indirectly supporting various sectors, including healthcare. While it's difficult to quantify the exact contribution, it's clear that the global flow of capital, fueled by U.S. healthcare profits, plays a role in supporting New Zealand's ability to fund its universal healthcare system. The interconnectedness of global healthcare finance raises ethical questions. People in one country are, in a sense, funding the healthcare of those in another, but it happens through a system where profit is a primary driver. This raises concerns about fairness and equity. Is it ethical for a system driven by profit to indirectly support a system that prioritizes universal access and affordability? This question highlights the complexity of global healthcare finance. Finding solutions to the ethical dilemmas posed by global healthcare finance requires international cooperation. Governments and organizations need to work together to ensure that healthcare is accessible and affordable for everyone. This involves exploring alternative models of healthcare funding that prioritize patient needs over profit. It also calls for greater transparency in the financial flows within the global healthcare system. Healthcare is a fundamental human right. Ensuring its accessibility and affordability is a shared responsibility that transcends national borders. The global community must work together to create a more equitable and just healthcare system. This involves addressing the disparities in healthcare spending and profit margins between countries. It also requires finding ways to ensure that the financial benefits of healthcare reach those who need it most, regardless of where they live. The interconnectedness of global healthcare finance highlights the complex relationship between profit and access to essential medical services. While profits from the U.S. healthcare system indirectly support healthcare in countries like New Zealand, it raises ethical concerns about the role of profit in a system meant to serve human needs. Bridging the gap between profit-driven healthcare and universal access requires a global effort. By working together, we can strive to create a healthcare system that prioritizes the well-being of all individuals, regardless of their nationality or financial status.